questions from the prior video, as well as an ultrasound exam and a few new quiz questions. So this was one of the images I gave on the prior video. This is a skull radiograph in the Waters view, and the abnormality in this radiograph is this crescent-like lucency projecting under the left superior orbital rim. This is known as the black brow sign, and it indicates a fracture of one of the paranasal sinuses associated with the left orbit. This is some air from the paranasal sinuses extending into the orbit. The second quiz question I gave was this image, and the diagnosis here is cerebral proliferative angiopathy. So moving on to our case for the day, or case for the video. This is an ultrasound exam, and we're going to go through it. Here is the pancreas. Again, the pancreas and the splenic vein. Again, pancreas, this is the region of the tail of the pancreas, and it's obscured by overlying bowel gas. This is often the case. Here we're catching a little bit of the liver, and it's more or less homogeneous in echogenicity. There's no nodular contour. We can see the portal triads fairly well, and we can see the posterior surface of the diaphragm, of the liver, fairly well. And going through the images of the liver, it is pretty normal in appearance. We get a sort of scout view of the right kidney and Morrison's pouch over here, and the kidney demonstrates normal cortical medullary differentiation. It's normal in size, there's no focal abnormality, there's no free fluid within Morrison's pouch. We haven't seen any focal hepatic mass, and again, we have the diaphragm here, and the liver looks pretty normal. Here we're looking at the main portal vein. It's normal in caliber, and on spectral analysis, we have normal phasicity of the main portal vein. Looking now at the gallbladder, we can see some shadowing material lying independently within the fundal portion of the gallbladder. Again, we see this shadowing material. We have some thickening of the gallbladder wall, measuring at approximately 5 millimeter. Normal is less than 3 millimeter. Here we have the common bile duct measuring at about 5 millimeter. That's within normal limits. The top normal is 6 millimeter, and that's usually for a patient under the age of 50. So here we're just looking through the liver with some Doppler signal and no abnormality. Again, looking at the kidney, and pretty normal in appearance. Looking at the spleen now, and it is homogeneous, no focal abnormality. Looking at the left kidney, also pretty unremarkable. So this patient also had a positive sonographic Murphy sign, and that means that there was pain, maximal pain, with pressure of the ultrasound probe directly overlying the gallbladder. That's what the sonographic Murphy sign means. So we had some of that shadowing echogenic material compatible with gallstones and a positive sonographic Murphy sign. So this is a case of acute cholecystitis, acute calculus cholecystitis. We'll look at one more example of acute calculus cholecystitis. And here we have some biliary sludge and a stone within the neck of the gallbladder. Thickened gallbladder wall, 6 millimeter, and this patient also had a positive sonographic Murphy sign. So this is another case of acute calculus cholecystitis. In this case, we see the gallbladder wall here. However, it appears to be within some sort of cavity, and as we examine the rest of the gallbladder, the remaining portions of the gallbladder do not have that appearance. So this is slothed off gallbladder wall, and we can also see here with some Doppler signal that some areas of the gallbladder wall have less vascularity compared to other regions of the gallbladder wall, especially here. So this is compatible with gangrenous cholecystitis. And one more cholecystitis case. This is the gallbladder, and here we have some very bright echogenic material with some dirty shadowing appearing to be located along the gallbladder wall, or in this case within the gallbladder wall. And you can see it on a few views, and this is a case of emphysematous cholecystitis. So those are our cases for today. A couple more quiz questions. Our first quiz question, so here you go. What is the diagnosis and what is the suspected history of this patient? Okay, and one more case. What is the source of the pleural effusion on the right? You can leave your answers in the comments as well. If you have any questions or suggestions or something else you'd like to see, you can also leave that in the comments. If you like the video, give it a thumbs up, and if you want to see more, then subscribe to the channel. Thank you.